Today's topic for the discussion is anatomy of the extensor compartment of the forearm. This is the part 2 of a series of videos on the forearm. In the part 1 we had discussed about the flexor compartment of forearm. Today we will be discussing about the extensor compartment of the forearm. So this is Dr. Yusuf signing from Al Jouf University. These are the specific objectives which we have partly discussed and will continue further. In the first one, they demarcate the compartments of the forearm and enumerate the contents of each. Second is study the arrangement of muscles of each compartment of forearm and give their actions and nerve supply. We already finished the flexor compartment. Now we are going to the extensor compartment. The third is describe the flexor and extensor retinacula regarding their attachment and relations. We already discussed the flexor retinacula in the part 1, and today we will discuss about the extensor retinacula and its attachments as well as the relations as well as the compartment divisions of the same. So this is the division of the forearm. So if we take a section, we have discussed this flexor compartment of forearm, and today we will discuss the back of forearm, the extensor compartment of forearm. So these are the radius and the ulna, which are part of the bones of the forearm, and in between those radius and ulna we can see a thin connective tissue membrane. This is called as the interosseous membrane, and on the further lateral side of the bones we can see the intermuscular septum, so which will be dividing the two compartments into flexor compartment as well as the extensor compartment. So today we will discuss about this extensor compartment. So this extensor compartment, as I said before, is also called as the posterior compartment of forearm, or it is also simply called as back of forearm. Okay. So this compartment consists of 12 muscles. If you remember, I had told you that the whole of the forearm has 20 muscles. Out of those 20 muscles, 8 are in the flexor compartment and 12 are from the extensor compartment. In the flexor compartment, in the part 1, we have discussed that the 8 muscles are divided into 5 superficial and 3 deep. And today we'll study about the extensor compartment, where there are 12 muscles. Out of the 12 muscles, 7 are superficial and 5 are deep. So which are those muscles? We'll discuss one by one. Among the 7 superficial muscles, the first one is called as the brachioradialis. This is the most lateral muscle which is present in the forearm. This is called as the brachioradialis. First we will try to identify the muscles, later we will discuss in detail about each muscle. This is the brachioradialis. The second is the extensor carpi radialis longus. This is the muscle here, just deep to the brachioradialis. This is the second muscle which is called as the extensor carpi radialis longus. As I had told you before, that the name itself indicates a lot of things. We will discuss what does it indicate. The third is the extensor carpi radialis brevis. This is the carpi radialis longus. This is the extensor carpi radialis brevis. So I had told you the difference between the longus and brevis. Brevis is a shorter muscle and longus will be a long muscle. So that's why it is called as longus. Then a big muscle with a lot of divisions can be seen to going to the digits. This is called as the extensor digitorum. Extensor digitorum, as it goes to the lateral 4 digits, the middle 4 digits to be more specific. Then we have the medial to that will be the one muscle called as the extensor digiti minimi muscle. So the extensor digiti minimi, and deep or more medial to that will be the extensor carpi radialis ulnaris. So this toward the ulnar, that's what is called ulnaris. Here will be the radialis and here will be the ulnaris, depending on towards which bone it is there, because this is on the medial side, so the ulnar bone is there, so that's why this is called as the extensor carpi ulnaris muscle. Then the last muscle is a small muscle called as unconius. So I will repeat one more time. So this is the most lateral muscle. This is called as the brachioradialis. Just medial to that will be the extensor carpi radialis longus. Then we have the extensor carpi radialis brevis. Then the extensor digitorum. Then we have the This is called the extensor deity minimi muscle. Then we have the extensor carpi ulnaris muscle. Then the final muscle is the anconeus. So this is the compartment. This is called as the extensor compartment or posterior compartment of the forearm or the back of forearm. Okay, with seven superficial muscles, and then we'll go to the 5 deep muscles. Which are those? The first one is called as supinator. So if you remove all the superficial muscles, then you can see these muscles. If not, you cannot see. So here all the superficial muscles have been removed. So you can see the deep muscle. So this is the anconeus, which is still there, along with the brachioradialis as well as the external carpi radius longus, as well as even the carpi radialis brevis is also there. Okay, deep under there, especially if you remove the digitorum, then you can see all these deep muscles. So the first muscle is called the supinator. This is the supinator muscle, and in part 1 we had discussed that this supinator along with the biceps brachii will help in the supination of the forearm. The second is called the abductor pollicis longus. Abductor pollicis longus is the second muscle. Then we have the extensor pollicis brevis. Extensor pollicis brevis, this is the third muscle. Then we have the extensor pollicis longus. This is the extensor pollicis longus. Then we have the last muscle. This is called the extensor indicis. Extensor indicis. These are the 5 muscles. One is the supinator. Then we have the abductor pollicis longus. Then we have the extensor pollicis brevis. Then we have the extensor pollicis longus. Then the last muscle is the extensor indicis. These are the 5 deep muscles. Then we have seen the 7 superficial muscles. 7 superficial and 5 deep. Okay, totally 12 muscles of the back of forearm. Before we proceed further, we should know some basic points of the forearm, especially the extensor compartment. We already discussed about the basic features of the flexor compartment in the part 1. Now we'll be discussing the extensor compartment of extensor compartment of forearm with the brief introductory points which you should remember, which are common. So the first is all the superficial muscles of the extensor compartment of forearm will be crossing the elbow joint, just like in case of the flexor compartment. Here also the superficial muscles will be crossing the elbow joint, but not the deep muscles. They are also in the flexor compartment. All superficial muscles will be crossing the elbow joint, and then the deep muscles, they don't cross, because the superficial muscles will be taking origin from a common point called as the common flexor origin, or the important part from where they will be taking origin will be the medial epicondyle of the humerus. Similarly, here also there is a common origin for all the extensor muscles, the superficial muscles of the forearm. That point is called as the lateral epicondyle of the humerus. So the flexor muscles, superficial muscles of the flexor compartment will be taking origin from the medial epicondyle, and the extensor muscles, superficial muscles, will be taking origin from the lateral epicondyle of the humerus. Okay, except there are exceptions. So one is the brachioradialis as well as the extensor carpi radius longus, which will be instead of taking origin from the epicondyle of the humerus, the lateral epicondyle of humerus, so it will be slightly shifted upwards. Okay, we'll see that. Then the anconeus, this is the smallest muscle, the last muscle among the 7 muscles, will be shifted slightly backwards and downwards. Okay, this is the only exception. If not, all other muscles will be taking origin from the lateral epicondyle of the humerus. Okay, this is called as the common extensor origin. Coming to the nerve supply, out of the 12 muscles, 3 muscles are supplied directly by the radial nerve, that is the brachioradialis, the extensor carpi radialis longus, as well as anconeus, which have shifted upwards or backwards. So they are directly supplied by the radialis nerve. The remaining 9 muscles are supplied by the posterior interosseous nerve, which is a division or a branch from the radial nerve. So to be more specific, all the muscles of the extensor compartment of the forearm are supplied by the radial nerve, or its branch, that is the posterior interosseous nerve. Now coming to the superficial muscles of the forearm. Now let's study in more detail about each individual superficial muscle. Then we'll go to the deep muscle. So the first superficial muscle is brachioradialis. So here is the muscle. So this muscle, even though this belongs to the extensor compartment of forearm, this is more clearly seen in the flexor compartment, because it enters the flexor after its origin. It will be entering the flexor compartment of forearm, and it will be more on the lateral side of the flexor compartment of forearm. So this can be more clearly seen in the flexor compartment of forearm than the extensor compartment. So the origin of this muscle is from the upper two-thirds of the lateral supracondylar ridge. There is a ridge just above the lateral epicondyle of the humerus, that is called a supracondylar ridge. So this is the lateral condyle of this is the lateral epicondyle. Here is below will be the condyle, and this is the lateral epicondyle of the humerus. Above the lateral epicondyle of the humerus, this lateral border, this is called the supracondylar ridge. So this muscle will be taking origin from the upper two-thirds of this lateral supracondylar ridge, and the lower one-third is for the extensor carpi ulnaris, radialis longus. Sorry, extensor carpi radialis longus will be the next muscle which will be taking origin from the lower one-third. So the upper one-third is mainly occupied by the brachioradialis. Here you can see that this is the brachioradialis, which is occupying or taking origin from upper two-thirds of the supracondylar, lateral supracondylar ridge. There is medial as well as lateral. This will be taking origin from the lateral. Just below that will be the origin of the extensor carpi radialis longus. Okay. So this is one origin of this muscle, from the upper two-thirds of the lateral supracondylar ridge, as well as it will be also taking some fibers will be also taking origin from the lateral intermuscular septum. The intermuscular septum between the bone, the humerus, as well as it will be going a thin modified D fascia, which will be going all the way up to the total covering of the arm. So which will be dividing the whole of the flexor and extensor compartment to two separate compartments by the presence of this the connective tissue layer between the flexor and extensor compartment. So this muscle not only take origin from the lateral supracondylar ridge, but also from some part even takes origin from the lateral intermuscular septum. So this is the origin of this muscle, and this muscle will run downwards. As I said, it enters the flexor compartment even though it belongs to the extensor compartment, and runs along the lateral side of the extensor flexor compartment of forearm, and then get inserted to the base of the styloid process of the radius. So the radius here. So this is the insertion of this muscle. It gets inserted to the base of the styloid process. So this is the styloid process of the radius, and it get inserted to the base of the styloid process of the radius. Nerve supply is by the direct supply from the radial nerve with the root values C5, C6 and C7. And the actions of this muscle, because this is in the flexor compartment of forearm, even though it belongs to the extensor compartment, it is a strong flexor of the elbow. This is the exception of this muscle. Even though brachioradialis is a extensor muscle, it helps in the flexion of the elbow. So it is a strong flexor of the elbow, especially in the mid-prone position, because it is on the lateral side. It will be much more stronger when it is in the mid-prone position. That is the main function of this muscle. Next, going to the extensor carpi radialis longus. That is the next muscle, which is just deep to the brachioradialis. Brachioradialis will be here. It has been removed. Now you can see the extensor carpi radialis longus. This is the muscle. Then deep to that is the extensor carpi radialis brevis. Okay, extensor carpi radialis longus will be taking origin from the lower one-third of the same lateral supracondylar ridge. In the upper two-thirds, we have seen that it will be for the origin of the brachioradialis, and the lower one-third will be mainly for the extensor carpi radialis longus. Okay. This also take origin slightly, some fibers especially from the lateral intermuscular septum. This muscle runs deep to the brachioradialis as well as lateral in the forearm, and then winds back and comes to the extensor compartment. Even though it is on the lateral side, then it get inserted to the dorsum of the base of the second metacarpal bone. You can see here, this is the tendon of the extensor carpi radius longus getting inserted to the base of the second metacarpal bone. So here we can see, so this is the first, as I told, it is counted from lateral to medial side. So this is the thumb, so this is the first metacarpal, this is the second, third, fourth and fifth. So it get inserted to the dorsal surface. This is not the plantar palmar surface, this is the dorsal surface of the base of the metacarpal. As I said, the whole of the metacarpal has a head, a shaft and a base. So it get inserted to the dorsal surface of the base of the second metacarpal bone. Nerve supply, again it is from the direct branch coming from the radial nerve. Actions of this muscle, this is the chief extensor of the wrist joint along with the extensor carpi radialis brevis as well as the extensor carpi ulnaris. So these are three muscles which help in the extension. These are the chief extensors. Even though there are 12 muscles, these acts as the chief extensors of the wrist joint. The extensor carpi radius longus as well as even the extensor carpi radialis brevis as well as the extensor carpi ulnaris. So this is one of the chief muscles of the extensor compartment, the extensors of the wrist joint. Because it is on the lateral side, it will be acting along with the flexor muscle, one of the lateral muscles in the flexor compartment, that is the flexor carpi radialis, and this the extensor carpi radialis longus along with the extensor carpi radialis brevis, extensor carpi radialis brevis will be helping in the abduction of the wrist joint. Abduction is the lateral movement of the hand, okay, toward the lateral side, just moving on the lateral side, that will be called as abduction. So this mainly helps in the abduction of the wrist joint along with the flexor carpi radialis. So three muscles helps in the abduction of the wrist joint. One is the flexor carpi radialis, then the extensor carpi radius longus as well as the extensor carpi radialis brevis. And this also helps in the assist in the movement of the digits, that is the fingers, okay, because it fixes the second metacarpal bone. So here again you can see this is the muscle, this is called as the extensor carpi radialis longus. This is the extensor carpi radialis longus, which is taking origin from the lower 1/3 of the lateral supracondylar ridge, and here is the lateral epicondyle of the humerus, from where the muscles of the extensor compartment are taking. This is called as the common extensor origin, okay. So this is the extensor carpi radius longus, then we go to the extensor carpi radialis brevis. So here you can see, here will be the origin of this extensor carpi radius longus and goes and get inserted to the second dorsal surface of the base of the second metacarpal, extensor carpi radius longus. Then we go to the third muscle, that is the extensor carpi radialis brevis. Here you can see the same muscle. Coming to the extensor carpi radialis brevis, so this will be taking origin from the common extensor origin. This is the first muscle among the three muscles we have discussed. The brachioradialis will be taking origin from the upper 2/3 of the supracondylar ridge. Lower 1/3 will be for the origin of the extensor carpi radius longus. Now this is the first muscle among the group of muscles which will be taking origin from the common extensor origin. This is the first muscle, that is the extensor carpi radialis brevis. This is the extensor carpi radialis brevis. You should remember the names, and they, as I said, they will be indicating many things. Extensor because it belongs to the extensor compartment, carpi because it will be going to the carpal bones, and then radialis because it is on the radial side, and brevis because it is shorter than the longus. Longus is a long muscle, brevis is a shorter muscle, so that's why it is called as brevis muscle. So this is the extensor carpi radius longus and this is the brevis. You can see the difference between the two, okay. Now coming to the here will be the common extensor origin, so it will be taking origin from the common extensor origin. And the second origin of this muscle is from the radial collateral ligament of the elbow. So there will be a radial collateral ligament here, so it will be taking origin from the radial collateral ligament of the elbow also. Coming to the insertion, this will be going down, runs deep to the extensor carpi radius longus on the lateral side and goes and get inserted to the bases of the second dorsal surface of the bases of the second and third metacarpal bones. Here will be insertion of these two this muscle on two metacarpal bones, dorsal surface of the base of the metacarpal bone, second and third. Nerve supply, this will be supplied by the radial nerve indirectly through its prime, that is the posterior interosseous nerve, with the root values of C7 and C8. This muscle will be a very important extensor of the wrist joint, along with the extensor carpi radius longus as well as the extensor carpi ulnaris. As I said before, three muscles are the chief extensors of the wrist joint, that is the extensor carpi radius longus, then extensor carpi radialis brevis as well as the extensor carpi ulnaris. The second muscle, because it is on the lateral side, this will be acting along with that of the one of the flexors and one of the extensors, that is the flexor carpi radialis as well as extensor carpi radialis longus, to help in the abduction of the wrist joint because it is on the lateral side. The third important function is it helps in the or assists the movements of the digit, because these muscles will be fixing the second metacarpal bone and then helps in the movement at the metacarpophalangeal as well as interphalangeal joints. Now let's discuss about the extensor digitorum. The extensor digitorum is called so, the extensor because it belongs to the extensor compartment, and digitorum because it divides into 4 slips and get inserted to the 4 digits, the middle 4 digits, second, third and fourth and fifth. Okay, that's what is called as extensor digitorum. We'll see in detail how it divides and get inserted. So the origin of this muscle is from the common extensor origin, that is the lateral epicondyle of the humerus. The insertion, as I said, this muscle, as you can see, and this is the picture of this muscle, this is the extensor digitorum. It divides or splits into 4 parts and then goes all the way to the medial 4 digits to the and get inserted to the bases of the middle as well as the distal phalanx. It splits into 3 slips. Let's see. So this is the extensor digitorum taking origin from the common extensor origin, that is the lateral epicondyle of the humerus, runs all the way downwards and splits into 4 slips, and then each slip will go to each digit. And here, if you see here, near the shaft of the second middle phalanx, it splits into 3. It splits into 3. Okay, 3 slips actually in the proximal phalanx. It splits into 3, and the middle slip will get inserted to the base dorsal surface of the base of the middle phalanx, and the 2 slips, one on the medial side, one on the lateral side, run forward and join together and get inserted to the dorsal surface of the base of the distal phalanx. This is same for the second, third, fourth and fifth. So all the way each of these slips will divide into again 3 slips. The middle slip will be getting inserted to the dorsal surface of the base of the middle phalanx, and the 2 lateral slips, lateral medial one, will join together and get inserted to the dorsal surface of the base of the distal phalanx. So this is about this muscle. Okay, so this happens in the second digit, third digit, fourth digit as well as the fifth digit. Okay, this is how it get inserted, and this is the area where they get inserted to the dorsal surface of the base of the distal phalanx as well as the middle phalanx. Okay, and the origin is from the common extensor origin. So this is the extensor digitorum origin and insertion. Okay, this, if you see this splitting as well as getting inserted, this is very similar to the tendons in the flexor compartment of the forearm. If you remember, especially the flexor digitorum superficialis, it will be running all the way and getting inserted to the it splits into 2 slips and get inserted to the shaft on either side of the middle phalanx, and the flexor digitorum profundus will be passing through these 2 slips and getting inserted to the base on the palmar surface of the base of the distal phalanx. Okay, there two muscles will do this, and here a single muscle called as the flexor digitorum will be splitting into three slips and getting inserted to the middle phalanx as well as the distal phalanx. Okay, of the dorsal surface of the phalanges. Okay, the second, third, fourth, and fifth digits. Okay. Coming to the nerve supply is by the branch of the radial nerve, that is the posterior interosseous nerve. Coming to the actions, this as it get inserted to the bases of the middle phalanx as well as the distal phalanx, so hence it will be helpful in the extension of the interphalangeal joint, the proximal as well as distal interphalangeal joint, as well as the metacarpophalangeal joint, as well as the wrist joint from the second to fifth fingers. So because it is crossing all this joint and getting inserted to the distal phalanx, so it helps in the extension because it is in an extensor compartment. It is present in the extensor compartment and it is extensor muscle, so it helps in the extension of the interphalangeal joint, proximal and distal, as well as the metacarpophalangeal joint, as well as even the wrist joint. Okay, so this is about the extensor digitorum. Okay, so here is the extensor digitorum, its origin, insertion, and splitting. Okay, now coming to the smaller muscle, this is called as the extensor digiti minimi. So this is the muscle. This is called as extensor digiti minimi. As the name indicates, extensor means it is in the extensor compartment. Digiti minimi because it is getting inserted to the little finger. Digiti minimi is the other name for the little finger. If you see here, this is the extensor digiti minimi. So origin is from the common extensor origin and going all the way and get inserted along with the tendon of the extensor digitorum and get inserted to the little finger by the same three slips of the digitorum. Okay, so the origin of this muscle is from the common extensor origin, and the insertion it joins the tendon of the extensor digitorum of the little finger and get inserted to the dorsum of the base of the middle as well as the distal phalanx of the little finger. Okay, so because it get inserted joins with the slip of the extensor digitorum which is going to the little finger and get inserted in the similar fashion of that of the extensor digitorum in the little finger, only in the little finger, not to the other digits. Okay, so that's what is called as extensor digiti minimi, and this is also supplied by the same posterior interosseous nerve, which is a branch from the radial nerve. Coming to the actions, because it is inserted to the only to the little digit, so it has action on the little digits as well as the proximal joints before that. So it helps in the because it belongs to the extensor compartment, so it helps in the extension of the interphalangeal joint, that is the proximal as well as distal interphalangeal joint, as well as the metacarpophalangeal joint of the little finger, not for the other digits but only of the little finger because it is going only to the little finger, as well as even some action on the wrist joint also. It helps in, it is a weak flexor or a weak extensor of the wrist joint. Okay, so this is about the extensor digiti minimi and why it is called so. Okay, next going to the extensor carpi ulnaris. The extensor carpi ulnaris is called so because it belongs to the extensor compartment, that's why it is extensor. Carpi because it is going to the carpal bone, and it is called ulnaris because it is towards the ulnar side. The muscles which are on the radial side, that will be called as radial, and these are called as ulnaris. So these are called as radialis on the lateral side, and which are towards the medial side towards the ulnar bone, those are called as ulnaris. Okay, so that's what is called as extensor carpi ulnaris. The origin of this muscle is from the same common extensor origin. So this is the last muscle to be taking origin from this common extensor origin. So this extensor carpi ulnaris. Also, it will be taking origin from the posterior border of the ulna by an aponeurosis, along with flexor carpi ulnaris as well as flexor digitorum profundus. There are three muscles which will be taking origin from the posterior border of the ulna. I told you when we are discussing the flexor compartment, that flexor carpi ulnaris, as well as if you see here, this is the flexor carpi ulnaris muscle. Then we have the flexor digitorum profundus, as well as this muscle, that is the extensor carpi ulnaris. All these three muscles will join together, form an aponeurosis, and then they will be taking origin from the posterior border of the ulna. All these three muscles. Okay. So these three muscles will be taking origin from the posterior border of the ulna, as well as this muscle also take origin from the extensor carpi, the lateral epicondyle of the humerus, that is the common extensor origin. This muscle, that is the extensor carpi ulnaris, will run downwards and get inserted to the base of the fifth metacarpal bone. So base of the fifth metacarpal bone, dorsal side, if you can see here. So this is the muscle extensor carpi ulnaris running all the way downwards on the medial side and get inserted to the dorsal surface of the base of the fifth metacarpal. Okay. The nerve supply is by the posterior interosseous nerve. Actions: because it is on the medial side, this muscle will be mainly helping in the extension of, this is because it belongs to the extensor compartment. It will be helping in the extension of the wrist joint, along with the extensor, which are the two muscles which are on the lateral side, that is the extensor carpi radialis longus as well as the extensor carpi radialis brevis. All these three muscles will be the chief extensor at the wrist joint and at the elbow joint as well as the wrist joint, and they will be helping in the extension of the wrist joint as well as even the elbow joint. Okay. Because it is on the medial side, this acts along with the flexor carpi ulnaris. The extensor carpi ulnaris along with the flexor carpi ulnaris will be helping in adduction of the wrist joint. The adduction is moving the hand toward the medial side, towards the central axis, towards the little finger. Okay, without bending. That is called as the adduction of the hand. So flexor carpi ulnaris as well as extensor carpi ulnaris, which are both on the medial side, ulnar side, helps in the adduction of the hand. As well as this also helps in the fixation of the wrist joint, especially when you are moving the digits. Okay. So this is about the extensor carpi ulnaris, which is the most medial muscle in the extensor compartment. Here you can see the same muscle again, and this is how it is taking origin from the medial border. If you can see the posterior border of the ulna, sorry, this is the posterior border of the ulna, and this muscle is taking origin from the posterior border of the ulna along with the flexor carpi ulnaris as well as the flexor diatom profundus. Now going to the last muscle, small muscle, that is called as the anconeus. This is the small muscle, smallest muscle in the extensor compartment, in the superficial muscle. This is the anconeus. This will be taking origin not from the common extensor origin, but it has shifted slightly backwards, and it will be taking origin from the posterior aspect of the lateral epicondyle. Instead of the lateral epicondyle, this will be taking origin from the posterior surface of the lateral epicondyle. The insertion of this muscle, because this is a short muscle, it will be running laterally from the lateral to medial side and get inserted to the ulna, especially on the lateral surface of the olecranon process. This is called as the olecranon process of the ulna. So it will be getting inserted on the lateral surface as well as the posterior 1/4 of the posterior surface of the ulna. So this is the upper 1/4 of the posterior surface of the ulna as well as even the lateral side toward the radius here. Okay, that will be the lateral surface of the olecranon process as well as the posterior upper 1/4 of the posterior surface of the ulna. This is the insertion of the anconeus. Origin from here and insertion will be here. So it is a very short muscle among the superficial muscle. The nerve supply is by the direct branch coming from the radial nerve, and the actions, it is a weak pronator of the forearm along with the other muscles, okay, which is the pronator teres as well as the pronator quadratus. So this also helps in the pronation, even though it is in the extensor compartment along with the two muscles of the flexor compartment. This helps in the pronation, but this is a weak pronator, and the strong pronators are the pronator teres as well as the pronator quadratus. Then this helps in the pronation as well as because it belongs to the extensor compartment, The action is mainly on the extension of the elbow joint, because it crosses only the elbow joint, so it can have action only on the elbow joint. There is no action of this muscle on the wrist joint or any other smaller joints, because it doesn't come all the way here. It begins at the elbow joint, ends at the elbow joint. Okay, this is about the unconius. Now let's discuss the deep muscles, or the 5 muscles which are there in the extensor compartment of forearm. The first muscle and the smallest muscle among this deep muscles will be the supinator. Supinator is a very important muscle which helps in supination of the forearm. This will be taking origin from the radial collateral ligament of the elbow joint. So there will be radial as well as the ulnar collateral ligament. This will be taking origin from the, because it is on the lateral side, it will be taking origin from the lateral collateral ligament or the radial collateral ligament, then as well as a ring like ligament around the neck of the radius, that is the annular ligament. Then it also take origin from the, all this cannot be seen here in these pictures, inside will be the all these features, as well as it will be taking origin from the supinator crest of the ulna, as well as the posterior part of the triangular area in front of it. Okay, so it will be taking origin from the triangular part here. This is the triangular part between the radius and the ulna. So it will be the posterior part of the triangular area in front of the supinator crest. There will be a small crest here, that is called a supinator crest, and behind that will be the triangular ligament, which will be on the lateral side of the ulna. So this will be taking origin from the triangular area which is on the lateral side of the ulna, and this muscle will run behind the radius, and it winds around the radius and get inserted to the upper 1/3 of the lateral surface of the radius. So it will be inserted on this part, that is the lateral 1/3 of the upper 1/3 of the lateral surface of the radius. Nerve supply is by the posterior interosseous nerve, and action is, as the name indicates, it is one of the supinator muscle of the forearm. Okay, supinator along with the biceps brachii, which also helps in the supination. The typical feature of this muscle is the posterior interosseous nerve runs between the 2 layers of this muscle. If you can see here in this picture, they have shown the posterior interosseous nerve passing through this muscle. So here also you can see this is the radial nerve. As it comes below near the elbow joint, it divides, and this muscle, this nerve, that is the posterior interosseous nerve, which is a branch from the radial nerve, passes through the 2 layers of the supinator. This is how the supinator can be identified. The second important muscle among the deep muscles of the extensor compartment of forearm are the abductor pollicis longus. So this is a very important muscle. As the name indicates, it helps in the abduction, as well as it get inserted to the pollicis. Pollicis means the thumb. Okay, and it is long muscle, so it is a long muscle. So here you can see this, the origin of this muscle. This is called as the abductor pollicis longus. It will be taking origin from the posterior part of posterior as well as the upper part of the radius and the ulna. So it is taking origin from the upper 1/3 of the posterior surface of the radius as well as the ulna. This is the radius and ulna, and in between is the interosseous membrane. So it will be taking origin from all these parts. Okay, the insertion of this muscle will be to the first metacarpal bone, base of the first metacarpal. If you can see here, if you remove this flexor digitorum, extensor digitorum, sorry, if you remove this extensor digitorum, then deep inside you can see this muscle. This is the abductor pollicis longus. So this is the muscle taking origin from partly from the radius, partly from the ulna, and partly from the interosseous membrane, going downwards on the lateral side and get inserted to the base of the first metacarpal bone. Nerve supply is by the posterior interosseous nerve, and the action, as the name indicates, it helps in the abduction of the thumb, as well as up to a certain extent even the extension of the thumb at the metacarpophalangeal carpometacarpal joint, because it is going and getting inserted to the metacarpal, so it doesn't cross the phalangeal joint. So it is only the carpometacarpal joint. Okay, So this is the muscle which is called as the abductor pollicis longus. So here is the muscle. This is how it is seen if you don't remove the extensor digitum. Once you remove the extensor digitum, this is how you can see the deep muscles. Okay, the first one is the abductor pollicis longus. As you can see, it is taking origin from the partly from the posterior surface of the radius as well as the ulna as well as the interosseous membrane. This is the origin from the abductor pollicis longus here, and getting inserted to the base of the first metacarpal bone. So abductor pollicis longus. So this will be the abductor pollicis longus. Then going to the next muscle, that is the extensor pollicis brevis. As the name indicates, this is again a muscle of the extensor compartment. Pollicis because it is again going to the thumb, and brevis because it is a shorter muscle compared to the extensor abductor pollicis longus as well as even the extensor pollicis longus. So this is a shorter muscle. So this origin of this muscle is from the posterior surface of the radius. So if you can see here, this is the origin of this extensor pollicis brevis. It will be taking origin from the posterior surface of the radius below the origin of the abductor pollicis longus as well as the interosseous membrane, not from the ulna, only from the radius as well as the interosseous membrane dorsal surface. And the insertion of this muscle is on the dorsal surface of the base of the proximal phalanx of the thumb. In the thumb, as you know, there are only two phalanges, the proximal and the distal. So this muscle will go and get inserted to the base of the proximal phalanx of the thumb. Nerve supply is by the posterior interosseous nerve, and as the name indicates, it helps in the extension of the thumb because it is going on getting inserted only to the thumb, so it will be acting on the thumb. So here you can see this is the extensor pollicis brevis. This is the abductor pollicis longus, and here deep inside you can see here this is the extensor pollicis brevis. As the name indicates, brevis, it is short muscle taking origin only from the posterior surface of the radius as well as the interosseous membrane below the origin of the abductor pollicis longus, and goes all the way and get inserted to the base of the proximal phalanx. If you can see here, this is the muscle going all the way up to the proximal phalanx. This is the abductor pollicis longus getting inserted to the metacarpal first metacarpal and the extensor pollicis brevis going all the way crossing the first metacarpal as well as getting inserted to the first proximal phalanx of the thumb. Okay. Then going to the next muscle, that is the extensor pollicis longus. After extensor pollicis brevis, this is the extensor pollicis longus. So it will be taking origin from the ulna side. Okay, so on the dorsal surface of the ulna as well as the interosseous membrane below the origin of the abductor pollicis longus, runs all the way along with the other two muscles and get inserted to the base of the distal phalanx of the thumb. As the name indicates, it is extensor pollicis because it is going to the thumb. So this muscle, this is the extensor pollicis longus, runs all the way taking origin from the posterior surface of the ulnar as well as the interosseous membrane, then goes all the way and get inserted to the distal phalanx of the thumb, base of the distal phalanx on the dorsal surface. Okay, nerve supply is by the posterior interosseous nerve. Actions: this muscle, because it is crossing all the joints of the thumb, so it acts on all the joint because it is in the extensor compartment, so it extends the carpometacarpal joint, interphalangeal joint, and even up to a certain extent even the wrist joint. Okay, so it helps in the extension of all the joints related to the thumb. The next muscle is extensor indicis. So this is again a very important muscle. This is the origin of this extensor indicis. This will be taking origin from the posterior surface of the ulna below the origin of the extensor pollicis longus as well as the interosseous membrane. So this is the origin of this muscle called as the extensor indicis, from the posterior surface of the ulna as well as the interosseous membrane below the origin of the extensor pollicis longus. The insertion of this muscle is into the index finger through the extensor digitum. That's why it is called as extensor indicis, because it is going to the index finger Okay, so it joins the tendon of the extensor digitorum. This is the extensor digitorum. Among these four digits, which slips, which will be coming from the extensor indicis, extensor digitorum. So one of the slip will be going to the index finger. So this index finger will be joined by one more tendon, which is coming from the extensor indicis. So if you can see here, the extensor indicis tendon joining with the, this is the slip going to the index finger. So it joins the tendon of the extensor digitorum and get inserted to the bases of the middle as well as the distal phalanx of the index finger. So it goes along the same slip as that of the extensor digitorum and get inserted to the it divides into three slips already you have seen. The middle slip will go to the middle phalanx and the two lateral medial slip will join together and goes to the dorsal surface or the base of the distal phalanx. So this is how it goes. An additional muscle will be attached to index finger. This is called as the extensor indicis. That's what is called as indicis, and because it is extensor muscle, that's why it is extensor indicis. Nerve supply is from the posterior interosseous nerve, again a branch from the radial nerve. Coming to the actions of this muscle, because it is going to the index finger, so mainly it will be acting on the all the, because it is crossing all the joints and getting inserted to the index finger. So it is helping in the extension of the metacarpophalangeal joint, interphalangeal joint, the proximal and distal interphalangeal joint, as well as even up to certain extent the wrist joint. Okay, so this is the function of this muscle called as the extensor indicis. So in this picture you can see this muscle, the extensor indicis. You can see only the slip coming joining with that of the extensor digitorum. This is the muscle extensor digitorum dividing into four slips. One of the slip is going to the index finger. So along with that there is one more tendon coming and joining. This is the extensor indicis. This is the extensor indicis. This is the muscle going and joining along with the tendon of the extensor digitorum and goes to the middle phalanx, splits into three slips. Middle slip will go to the middle phalanx and the two slips on either side will go and join and get inserted to the distal phalanx. Okay, so this is the extensor indicis. Now coming to something called as outcropping muscles. These muscles are typically seen, this especially the deep muscles among those, the three muscles, the abductor pollicis longa, extensor pollicis brevis, as well as the extensor pollicis longus. All these muscles will look like as though they are cropping out from the regular muscles. So all these muscles here are the posterior superficial muscles, here are the lateral superficial muscles. Okay, this is the brachioradialis, extensor carpi radius longus, as well as the extensor carpi radialis brevis. Here these are the lateral superficial muscle, and here are the posterior superficial muscle, that is the extensor digitorum, extensor digiti minimi, as well as the extensor carpi ulnaris. Among these two group of muscle, there are three muscles which are also from the posterior compartment, but these are three muscles which are deep inside, and they're going to the thumb. So, and they look like as though they are cropping out. So that's why these are called as outcropping muscle. These are the abductor pollicis longus, extensor pollicis brevis, and then the extensor pollicis longus. Okay, so these are the three muscles which are called as the outcropping muscles. If you can see here, so these are three muscles. This is the thumb, and three muscles are going to the thumb. These are called as the outcropping muscles among the posterior superficial as well as the lateral superficial muscles in the extensor compartment. So these are the three muscles which are the abductor pollicis longus, extensor pollicis brevis, as well as extensor pollicis longus. These are three muscles which are called as outcropping muscles. Now coming to some clinical important area called as anatomical snuff box. Anatomical snuff box is a triangular depression on the radial side of the wrist, which becomes visible when the thumb is fully extended. So this is how you can see a depression here. This is called as the anatomical snuff box. When the thumb is extended on the dorsal side, there will be a triangular depression which can be seen on the radial side of the wrist. So this depression is called as the anatomical snuff box. How it is formed? What are the boundaries? On the lateral side we have the abductor pollicis longus tendon as well as the extensor pollicis brevis. These are the two tendons which will be on the lateral side. of this anatomical snuff box, and on the medial side we have the tendon of the extensor pollicis longus. Here will be the extensor pollicis longus on the medial side, and on the lateral side we have the extensor pollicis brevis as well as the abductor pollicis longus. Okay, and the roof is formed by the skin as well as the fascia, superficial and deep fascia. Along with that, there will be a beginning of a very important vein called the cephalic vein. Cephalic vein and as well as the basalic vein are the two veins which will be beginning here from the dorsal venous arch on the lateral medial side respectively, and they will be draining the whole of the hand as well as the forearm of the upper limb. Okay, so this will be the site for the beginning of the cephalic vein. Okay, as well as even you can trace the superficial branch of the radial nerve at this point. And the floor of this anatomical snuff box is by the stellate process of the radius. Okay, as well as even the scaphoid as well as trapezium and the base of the first metacarpal bone can be felt at the base. If you palpate this area, this is called as the floor. Okay, where we can mainly feel the stellate process of the ulna of the radius, sorry, the stellate process of the radius. Along with that, some of the carpal bones like the scaphoid, trapezium, as well as even the first metacarpal bone can be, especially the base of the first metacarpal bone can be felt. Why it is called an anatomical snuff box? Because this is the area where some of the people who snuff the tobacco, they put the tobacco on this place and they used to snuff. So this because of this depression, so this is called as the anatomical snuff box. What is the clinical importance of this? This is the area where the radial artery lies, especially on the radius. Okay, so whenever there is a bone and on that is the artery, so easily you can feel the pulsation. So here this is the site where you can feel the radial arterial pulsations when you cannot feel at some other points. So when you cannot feel in other point, then you can easily trace the pulsation at this particular point, because it is a very simple area with depression, and on the floor we have the stellate process of the radius, and over that will be the artery running. So you can easily feel the pulsation of the radial artery in this position. Now coming to the extensor retinaculum. So here is the extensor retinaculum. So it is nothing but the modified deep fascia which is present on the back of the wrist joint, which is thickened to hold the extensor tendons in their place. There are so many muscles here. There are almost 12 muscles in the extensor compartment of forearm, and their tendons are running over the wrist joint and across the wrist joint, and they are getting inserted somewhere in the hand. So when they are crossing and during movement, flexion and extension at the wrist joint, these tendons might slip. So to prevent these tendons from slipping when they are contracting, they are covered by a thick modified deep fascia. This is called as the extensor retinaculum. So this is an oblique band which is directed downwards as well as medially. So if you can see here, this is the oblique band which is directed downwards as well as medially, and it is almost 2 centimeters in breadth. So here you can see again, this is the same extensor retinaculum band. Okay, so what are the attachments of this band, which is the extensor retinaculum? Medially, it will be attached to the one point will be attached to the stellate process, and the other points would be other parts of this medial part of the extensor retinaculum will be attached to the carpal bones, especially the triquetral as well as the pisiform bone. So where it will be attached, one point it will be attached to the stellate process, and the other parts it will be attached to the carpal bone. Those are the triquetral as well as the pisiform. On the lateral side, it will be attached to the radial border of the radius, radial border, anterior border of the, especially the anterior border of the radius. Okay, so here will be actually the stellate process of the ulna as well as the triquetral as well as the pisiform bone on the medial side, and on the lateral side it will be attached to the the lower part of the anterior border of the radius. Here will be the radius because this is the thumb, so here will be the radius, so it will be attached to the lower part of the anterior border of the radius. Okay, so this is the attachment. Medially we have the stellate process of the ulna as well as the triquetral and pisiform bone, and on the lateral side anterior border of the radius. So this extensor retinaculum will be giving rise to septa which are attached to the radius. Radius is much more broader near the distal part than on the proximal part. Okay, so it will be much more broader, and this extensor retinaculum will be giving septas, and this will divide this whole of this compartment into compartments. Okay, so the retinaculum gives rise to septa which are attached to the longitudinal ridges of the posterior surface of the radius, the lower end of the radius, and this turns in turn gives rise to 6 osteofacial compartment. If you can see here, so it is coming from the extensor retinaculum. Slips are coming and getting inserted to the lower part of the radius or the distal part of the radius, and this will turn the whole of the region into compartment. There are 6 osteofacial compartments. So what are these in this each compartment? Let's go and find out what exactly will be passing through this. The structures passing through each compartment of the extensor retinaculum from the lateral to medial side will be numbered from 1 to 6. The first compartment on the lateral side will be containing the tendons. If you can see here, this is how it is divided. Okay, the first compartment, there will be the abductor pollicis longus as well as the extensor pollicis brevis. These are the 2 tendons which will be present in the first compartment. The second compartment will have again 2 muscles. One is the extensor carpi radialis longus as well as the brevis. If you can see here, this is the extensor carpi radialis longus and the brevis, which will be passing through the second compartment. The third compartment will have 1 muscle. If you can see here, this is the cross section of the same. The first compartment, abductor pollicis longus, extensor pollicis brevis. Second compartment, extensor carpi radialis longus as well as brevis. The third compartment will have only 1 tendon. This is the extensor pollicis longus. The fourth compartment is the largest compartment. It will have 4 contents. One is the extensor digitorum, a very thick tendon with 4 slips which are going to the medial 4 digits. So this is the extensor digitorum. Then we have the extensor indicis, which is going to the index finger. Then we have the 2 important structures. One is the artery and one is the nerve. One is the posterior interosseous nerve, which is supplying most of the muscles of the posterior compartment of the forearm, and the anterior interosseous artery. This is an artery. Actually, the anterior interosseous artery will be in the flexor compartment. Then the common interosseous divides into anterior and posterior. Anterior interosseous will be supplying the most of the muscles in the anterior compartment, deep muscles, and the posterior interosseous artery will be supplying the extensor compartment. So the main artery supplying the posterior muscles of the forearm will be the posterior interosseous artery. Later, the anterior interosseous artery pierces, especially in the distal part of the forearm. It will be piercing. We'll show the picture where it will pierces the interosseous nerve, goes into the extensor compartment and joins with the posterior interosseous artery, but it continues as the anterior interosseous artery. Okay, so you can see the anterior interosseous artery in the posterior compartment. Then the fifth compartment will have the extensor digiti minimi, which is going to the little finger, and the sixth compartment will be having only one tendon here also, extensor carpi ulnaris. So these are the 6 compartments which are within the extensor retinaculum. So here you can see a brief review of the posterior interosseous nerve. So this is the posterior interosseous nerve which is passing through the supinator muscle and passing deep to the muscles, and it will be supplying most of the muscles of the posterior compartment of the forearm. So here you can see here, this is the supinator muscle through which this posterior interosseous nerve is passing and supplying most of the muscle. Here also you can see, as I told you about the artery, the common interosseous artery divides into anterior and posterior. Anterior interosseous artery will be supplying most of the muscles in the anterior compartment, and posterior interosseous artery is supplying the most of the muscles in the posterior compartment. Later, this anterior interosseous artery pierces the interosseous membrane, then goes into the posterior compartment, joins with the posterior interosseous artery, and continues as the anterior interosseous artery. Okay, this is the whole course of the the artery, and this is the branch from the radial nerve, that is the posterior interosseous nerve, which is supplying most of the muscles, okay, in the posterior compartment. So here also you can see the supinator through which this posterior interosseous nerve is passing and supplying the muscles, and here is the posterior interosseous artery, okay. And here are the osteophyseal compartments within the extensor retinaculum, starting from 1 to 6 compartments. So finally, coming to the applied aspect, one of the most important applied aspect is the injury of the radial nerve. So whenever there is injury to the radial nerve, especially above the origin of the posterior interosseous nerve, then it leads to paralysis of all the extensor muscles of the forearm, because it should be above the origin of the posterior interosseous nerve, because posterior interosseous nerve will be supplying most of the muscles of the posterior compartment of the forearm, and if it is above, it will also injure some of the branches which are going directly from the radial nerve to the three muscles which are the extensor, the brachioradialis, as well as the extensor carpi radialis longus, then the anconeus. So whenever there is injury to this radial nerve, the main muscles of the extensor compartment will be helping in extension. So this extension is lost, that leads to a condition called as wrist drop. So there is no extension, then it leads to a condition called as wrist drop, and this is because of the paralysis of all the most of the muscles of the extensor compartment of forearm, because of injury to the posterior interosseous nerve, which is supplying most of the extensor muscles of the forearm, okay. So this is the most important applied aspect related to the extensor compartment of the forearm, that is wrist drop because of the injury to the posterior interosseous nerve, and that nerve will be supplying most of the muscles of the extensor compartment of forearm. So these are all the references, and most of the pictures I have used in this presentation are from the Grace Anatomy for Students, as also some of the pictures from the BD Chaurasia, as well as Datta, as well as some Snells, and some other pictures from maybe from the website. So I thank all of them for the support. If you have any questions, you can write to me so that I will try to answer them. Thank you very much.